Today, my topic, as requested, is going to be on warts. And I want to employ everyone, please don't go around diagnosing anyone with this if you should see it. This is just for educational purposes, and I hope this will be helpful. So what are warts? Simple. Warts are non-cancerous, benign, rough bumps that form on the skin. So what are the causes of warts, and are they contagious? So when the human papillomavirus, HPV, enters a cut in the skin, it causes a skin infection that forms warts. Warts, they are contagious. The virus can spread from person to person or from different parts of the body through direct contact with the wart, touching something contaminated with the virus, such as towels, doorknobs, shower floors. Sexual intercourse gives you genital warts, nail biting, and cuticle picking, as well as shaving. So who might get warts, and what are the symptoms of warts? So children and teenagers are more prone to warts. Children, especially because a lot of them get cuts and bruises. However, anyone can get warts. People with autoimmune disease or weakened immune systems, including the elderly, are most susceptible to the virus that causes warts. Warts vary in appearance. They may look dome-shaped, flat, rough. Skin color may be brown, gray, or even black. And here's a photo of what that is, what that looks like. So what are the different types of warts? Wart types are depending on the affected body part. Types include, so on the hands, these warts are called common warts because they're most the common type. On the face, you have flat warts that affect the face and the forehead. On the feet, you have what's called plantar warts, appear on the soles of the feet. These warts look like calluses with tiny black dots in the center. They are often painful and form in clusters. Then you have genitals. Warts that form on the penis, the vagina, or rectum are called genital warts. These warts are a type of sexually transmitted infection. You can get genital warts through sexual contact with an infected person. Then you have periungual or subungual warts. These warts form under or around your fingernails and toenails. And here are some photos of what these looks like. So these are your common warts, the flat warts, the plantar warts, genital warts, even in the oral cavity. So how are warts managed and treated? Warts often go away on their own after your immune system fights off the virus. Because warts can spread, cause pains, and be unsightly, your doctor may recommend treatment options. Some of the options are at-home wart removal or over-the-counter wart removal medications, such as compound that contains salicylic acid. Freezing. During a freezing procedure, cryotherapy, which is done usually by your doctor applies a liquid nitrogen to freeze the wart. After freezing, a blister forms, eventually the blister and wart peel off. You may need several treatments, however, for this. Immunotherapy. For stubborn warts that don't respond to traditional treatments, immunotherapy helps your immune system fight the virus. This process involves a topical chemical, such as DCP. DCP causes a mild allergic reaction that makes this a wart. A mild allergic reaction that makes the wart go away. Then there's also laser treatment, and there's topical medicines that can be used. And these are just some photos of what those treatment looks like. So what are the complications of warts? Most warts go away without any significant problems. Sometimes warts, however, cause issues such as cancer. So HPV and genital warts are linked to several different cancers, including anal cancer, cervical cancer, and throat cancer. You can lower your risk of genital warts by getting the HPV vaccine and making sure that you're using condoms. Disfigurement. People with weakened immune system may develop unappealing clusters of warts on their hands, face, and body. Infections. Infections can occur if you pick or cut a wart. Breaks in the skin allow bacteria to enter. And then there's pain. Most warts don't hurt, but plantar warts can grow inward into the foot and be painful to walk on. You may feel as if there's a pebble under the skin. How can I prevent warts? There's really no way to prevent warts. However, you can lower your risk by picking up the risk of picking up the virus or stop warts from spreading by taking these steps. Avoid shaving over a wart. Avoid break the habit of biting on your nails. A lot of people like to bite their nail or pick on their cuticles. You shouldn't do that. Don't share towels, washcloths, clothing, nail clippers, razors, or other personal items. Don't touch another person's wart. If you haven't been vaccinated, you can speak to your doctor about the possibility of getting the vaccine. Keep your feet dry to prevent the spread of plantar warts. Try not to touch, cut, or pick at a wart. A lot of people like to actually do that. And when you wear flip-flops or shoes, when using public locker rooms, pool areas, or even showers. Important to know, if you or your child has warts, consider asking your provider, how did we get the warts? How can we keep warts from spreading to other parts of our bodies? What steps can we take to prevent getting more warts? What steps can we take to ensure our family members don't get infected? What's the best treatment for the warts? Should I look out for any signs of complication? Warts can be unsightly, as I discussed, and embarrassing. The good news is that warts often go away on their own. They can also respond well to treatment. The virus that causes warts spreads easily. Be sure to take necessary steps to prevent warts from infecting other people or other parts of your body. Your doctor can recommend the best at home or even in the doctor's office treatment to get rid of it. You should call your provider if the wart breaks open often, increasing the risk of infection or virus spread. If it causes embarrassment, if you develop a genital or rectal wart, if it itches, looks infected, is red or pus-filled, and makes walking painful or difficult for you. Over on my side here, to my right, you may see some photos, because I don't want people to confuse a mole from a wart. So this is a mole that my cursor's over, and this is what a wart looks like, just to be clear. I want to give special acknowledgement to NHS, Cleveland Clinic, and Harvard Medicine for the information that I provided to you today. Please feel free to join us in the Zoom room immediately after service, where I'll be happy to answer any questions for you. God bless, enjoy the rest of the service, and thank you so much for your time and attention.